Hello friends, this is Priya Bhalera and today's topic is anatomical and physiological changes according to trimester of pregnancy. Now you should know that what is pregnancy period. Pregnancy is divided in 3 trimester and its period is in month is 9 months 7 days, in weeks it is 38 to 40 weeks and in days it is 280 days. Pregnancy is counted from the moment of conception to the delivery of the baby. And what is conception? Conception is when a male sperm fertilizes a female ovum and that form a zygote. That is called conception. How will you know that the lady is pregnant? When she meets the period. In the first trimester, the pregnancy is counted from the first day of your last menstrual period to 12 weeks. Trimesters are very helpful to know the changes that happen on the mother's body and to the baby, and that's why it is divided into 3 categories, that is early, middle and late pregnancy or first, second, third trimester. And for that some investigations they are carried out: urine test, blood test, ultrasonography scan and other tests to rule out the changes that happens on the mother and the fetal body. Now the first trimester is a conception to 12 weeks period, second trimester from 13 weeks to 24 weeks and third trimester, that is 25 to 40 weeks. First trimester changes in body since conception to 12 weeks of pregnancy. Now there are weeks, there are anatomical changes, there are physiological changes. In 3 to 8 weeks there is a embryonic development, or it is called as embryonic period. Then what is embryo? Embryo is the early developmental stage and the period of embryo is from 3 to 8 weeks, that is called embryonic period. The other changes that physiological changes that happens on the mother, that is changes in body's hormone. There is lots of hormonal changes in the mother's body: nausea, vomiting, food craving, food aversions means obsession for food, mood swings and tiredness. In fifth week the embryo measures about 2 mm in length, that is brain and spinal column starting to form. The first organ that develops in the embryo, that is brain and spinal column. Most of the time there is a question on this, which organ that develop in the embryo first, that is brain and spinal column. Physiological changes, secretions of the SCG. What is SCG? SCG is a human chorionic gonadotrophic hormone. It appears in the blood and urine of the pregnant woman as early as 10 days after conception, and by SCG you can detect the age of fetus. Then mother cardiac output start to increase. At 6 to 7 weeks embryo is 1 centimeter long. By the end of 7 weeks fetal heart rate can be heard. When you go for ultrasonography, that time the obstetrics used to ask you to heard the sound of your baby's heart. That at 6 to 7 weeks means near about 1.5 to 2 months you can hear the fetal heart rate, fetal heart sound. In physiological changes, there is a breast tenderness of the mother. There is a painful breast, and on touching there is a tenderness of breast. At 7 weeks placenta is starting to form. CRL, that is crown to rump length of embryo, can be measured in ultrasonography. And the CRL, the baby is measured in centimeter from top of the head. Top of the head means crown, to the bottom of their buttocks, that is rump, means from head to the buttocks the length is measured in centimeter, that is called CRL length. The physiological changes, that is constipation, difficulty in motion passing. At 8 weeks means at near about 2 months the embryo is 1.3 centimeter long, and all these numerically you have to remember. In physiological changes, there is a morning sickness. It increases and urinate more often. Morning sickness, that means nausea, vomiting, headache, and all the symptoms they increases, and there is a frequency of urination. Mother frequently goes to toilet. At 8 to 10 weeks fetal heart tone can be observed through Doppler. 10 weeks fetus 3.5 centimeter long, fetal weight 8 gram, fetal all organs have found but not working 8. At 10 weeks means near about 2.5 months all organs of the fetus they develop, but there is no any functioning of that organ. Internal sex organ have developed, but not external sex organ. And you should remember this point. All the organs develop, but not external sex organ. In the physiological changes, fetal heart beats 180 beats per minute, 3 times faster than adult heart rate. Normal adult heart rate is 70 to 80 beats per minute, and it's the fetal heart rate is 180 beats per minute. That means 3 times faster than adult. At 12 weeks, fertilized ovum to fetus length 12 centimeter. Uterus become globular, amniotic fluid 50 ml. And you should know the fluid index, means the volume of the amniotic, the volume of amnion according to the weeks of the pregnancy. At 12 weeks it is 50 ml. At 20 weeks it is 400 ml, and at 36 to 38 weeks it is 1 liter, that is 1000 ml. Maternal immunoglobulin G crosses the placenta. Most of time there is a question, at which weeks the maternal immunoglobulin G crosses the placenta, then it is at 12 weeks. There is a in physiological changes, there are dark patches on the face and the necks, that is chloasma and linea nigra. There is a chloasma, means patches you can see on the cheeks and forehead of the mother, that is called chloasma. It is a pregnancy sign, and it is due to hormonal changes. Linea nigra is a dark vertical line that appears on the skin of the stomach of the pregnant lady. It is a hairy line. At 13 weeks, uterus height at symphysis pubis. There is also one question they ask, at which weeks the uterus reach to symphysis pubis, then it is at 13 weeks. And serum alpha protein level also increases. Now we will see the second trimester. Second trimester means the changes in the mother's body and the fetus or the baby between 14 to 24 weeks of gestation. At 14 to 16 weeks, the anatomical changes, fetus is almost 12 centimeter long. Physiological changes, visible veins on the breast, then ligament stretching in tummy and groin, and that's why there is a backache to the mother. And at 15 to 18 weeks, the head to bottom length of the fetus is 12.5 centimeter. And in physiological changes, triple test for Down syndrome is carried out of the fetus. You can say the anomaly scan. Anomaly scan is carried out in the second trimester, and it at which weeks? At 15 to 18 weeks. In that MSAFP, that is maternal serum alpha fetoprotein level is checked, SCG human chorionic gonadotrophin level, and UAV3, it is a marker for Down syndrome and trisomy 18 syndrome, and it is a marker for that test. And for that, because of this test, the anomaly scan is carried out. At 16 weeks, the uterine height midway between symphysis pubis and umbilicus. Now it's growing up. The uterine height is growing up. At 13 weeks, it was at symphysis pubis. Now at 16 weeks, it's growing between symphysis pubis and umbilicus. Thick yellow secretions from the breast. Beginning feeling of life in the multigravida, means the parents, they can feel the movements of their baby, and that is called quickening. It is at 16 weeks. At 16 to 20 weeks, varicose veins, leg cramp, fetal heart tone by stethoscope. There is a varicose veins because of pressure of because of weight of uterus. There is a decreased venous return, and that's why the varicose veins it exaggerate, and there are leg cramps, and for that most of time the obstetrician, the doctor, they advise exercises to the mother. At 18 to 20 weeks, fetal heart tone can be observed through fetoscope. Quickening, that is feeling of life in primigravida. At 20 weeks, that is fetus 15 centimeter long, cordycentesis is done, and active fetal movement by hand on the uterus. Linea nigra appears, amniotic fluid 400 ml. You should know the fluid volume. At which weeks? Already I have told. At 12 weeks it is 50 ml. At 20 weeks it is 400 ml, and 36 to 38 weeks it is 1 liter 1000 ml. 24 weeks, uterus height at the level of the umbilicus, cloasma gravidarum. appears. Now the last trimester or late pregnancy, the changes between 25 weeks to 40 weeks of gestation. Beyond 28 weeks, beyond 28 weeks means almost completion of 7 months. On abdominal examination, the doctors, they are able to diagnose presentation, position, attitude of fetus, where there is a vertex presentation, etc. And at 36 to 38 weeks, amniotic fluid is a 1000 ml. 36 weeks, uterine shape changes from cylindrical to spherical. 38 weeks, there is a lightning means welcome sign, baby is coming out, such a sign is there. And this sign is this experienced by mother, and that is called lightning, and it is at 38 weeks. Now some of the questions they are asked on this trimester of pregnancy. Lightning at which weeks? Lightning at 38 weeks. Quickening at, and please like and subscribe my channel, and if possible please answer this MCQ. Thank you.